then, or they're bigger, then you're advanced dry. Easy as that. Now, what exactly are these spots? Well, these spots, and I'll go further in my further on later in the day. I'll describe them as they're just rust particles. They're rust particles. That's all it is. And what happens with rust is that if you see a car with rust, it's actually this is a picture of a Caprice Classic. That was my first car. It was a hand-me-down from my brother, and it was a 13-year-old Caprice Classic. This is not the exact model I had. Mine was red. Okay, but it had similar characteristics. You know what the characteristics was? There was rust on the hood and there was rust everywhere. But you know what? I could still drive it. It was great, you know. As a college student and as it was one of the best cars I ever had. But it was a rust bucket. Now that's exactly what I look at when I look at your eye. If I see this drusen, this yellow stuff, it's just like looking at the hood of this Caprice Classic. There's rust there. So I know that there must be rust everywhere else, mind you. And furthermore, the thing is that it's still very useful because the rust hadn't gone to the critical part, the engine, or the water pump, etc., right? Now, the problem is that as dry macular degeneration advances, rust, what does rust do? It corrodes. And that's the problem. So let's say you have this corrosion, and this is the picture on the other side. You can see that it has holes on that piece of metal there, and there's holes on the door. Well, it's okay if there are holes in the door or holes in the piece of metal, and a lot of you could have this dry macular degeneration, and you could be seeing 20/20. And this eye over here that I look at, it has a lot of corrosion, but the center part is preserved. That means that you probably can see 20/20. It's just that if the corrosion progresses and it reaches the engine block, then the car won't run anymore, and you'll lose your vision. And that's what I call advanced dry macular degeneration. And what are the symptoms of dry? Usually no obvious symptoms. Although, if you studied it with Dr. Burson, who is a psychophysicist as well as a molecular biologist, he would say that in patients who have dry macular degeneration, you have some problems. And some of the problems include, like walking from a bright place to a dark room, okay? Which we don't do that in Florida, do we? I mean, it's not really that bright outside, and then we go into our house, and one of the first symptoms is that, like, you go into a bright place and you then you hit the column in the theater or something like that. That's very common for people who have dry macular degeneration, but they just blow it off, saying, "Oh, it's just part of aging." No, it's not part of aging. It's part of macular degeneration. The other thing is difficulty with contrast. And the contrast is very, very important, but it's also very difficult to measure. How do you figure out contrast? Well, contrast is when you look at a piece of paper and it looks washed out or grayish, right? It's all relative because you don't know how things are. Usually, you have to compare. But people with AMD, dry AMD in particular, they can have this washed out appearance, so everything looks like it's whitewashed everywhere. But you know, hey, that's how they're seeing, so that's how they perceive the world. So it's not really going to be a symptom that we can actually measure, unless you do tests like Dr. Broadway does, who's one of our low vision specialists. Now, wet AMD is the bad player. What is wet AMD? Well, most people who have wet AMD, they actually have had dry AMD, or some form of dry AMD. It's just natural. And the problem is what happens is that the rust actually is like an attractant. It's like a fertilizer for blood vessels to grow. Okay? And the work that I did 20 years ago, 15 years ago, was finding out what that fertilizer was. What triggered this rust to cause blood vessels to grow into the back of the eye. And this is why we have treatments now. It's because we figured this out back 15, 20 years ago. Now, what is the problem with having blood vessels in the very center of your vision? Well, blood vessels that aren't supposed to be there, they can leak and they can bleed. And they can form either a blister, a fluid blister, or a blood blister. That's what I'm going to show over here. Okay? So, when you are diagnosed with wet macular degeneration, if it's early, meaning that it hasn't bled yet, it's like this little blister on somebody's foot. Okay? It's a clear fluid blister. Now, you can see through a clear fluid blister, but in the back of your eye, what it does is it distorts the vision. Okay? Now, sometimes, and it's pretty bad because you can get a blood blister. And I just had a patient come on Tuesday, 5 o'clock, and had lost vision just in the morning. Sudden loss of vision, was count fingers, and had a huge blood blister inside their eye. The problem with that patient was that he was having problems because I'm sure when I looked at it and I examined him, he must have had this fluid blister for probably 6 months or 8 months, and it was 10 months since he was seen by his ophthalmologist before. Okay, so when you have a blood blister, and we'll talk about this later, it's very bad because sometimes we can't recover vision with it. Now, if we get it at the fluid blister stage, then there's a lot of hope for you. Okay. Now, the way I analogize wet is, the macula is like the rose garden. It's a rose garden. I like to garden. People that know me know that I love to garden. And you work very, very hard to preserve this beautiful rose garden, right? And my enemy has always been the dandelions. Okay? And that's exactly what's growing there. I hate dandelions. I mean, they annoy the heck out of me. And I do all I can, but I haven't had time to fix my garden lately, so I see a lot of dandelions and I cover my eyes. But that's exactly what we do. We're like weed killers. when we actually treat you for wet macular degeneration, we're trying to get rid of the weeds and leave the roses untouched. And that's how we've developed these treatments for wet macular degeneration. Now, a little bit more scientific, the schemata is this. Remember I told you that the far side is the blood vessels, and then the front side was the factory photoreceptors, and then the middle is where the garbage men are. And this is where the blood vessels grow into. It's almost like the pictures you saw for the tsunami in Sendai. It's really tragic. I'll digress a little bit because in November I just gave a lecture in Sendai. And I made several very nice friends there, but I've emailed them and they haven't responded, so I hope they're okay. But it's a bad situation. But if you look at the pictures of the Sendai coast, and I was there in November actually, you can see how the coastline has changed. And that's exactly what this is. This is like the beachfront, right? Where all the blood vessels are. That's where all the water was. And then you have sort of an encroachment of those blood vessels, which has taken over the land mass and done it in such a bad way. And that's what wet macular degeneration looks like, at least histopathologically. Now, what does it look like for people who have it? Well, this is a typical picture that we see. You can see this in multiple websites, and I'm sure people have talked about it. But the earliest signs that you have is when you have a fluid blister, all it does is you can see through the fluid, right? But it pushes the retina forward. And it causes a blister to form in the back of the eye. Now, when light is hitting the back of the eye, it's meant to be on a nice concave curvature. Imagine if you push it forward. So when you look at something and your retina is pushed forward, a line will have a bump on it, as if you're looking through the blister. And that's sort of what this Amsler grid is all about. But it's not very sensitive at detecting anything. If it's much later, then what happens is you start losing the very center of your vision. And when you're at that level, it's kind of bad. It means that you've probably bled a little bit, or that you've had it for too long a time, and the fluid is causing permanent visual loss, and that's actually a very bad sign. That's late findings. And the key to our treatments, and we'll talk about this in the future, is that you have to catch this early, okay? Now, this reduced central vision gets much worse, and eventually it'll affect a lot of different things. A lot of different things. So you might have a little bit of loss, but then if it gets bigger and bigger and bigger, you know, you then can't do much of anything. You can get around maybe, and the good news is that macular degeneration will never make you completely blind unless you have glaucoma along with it. And then you know, glaucoma is another disease which takes away your peripheral vision. This takes away your central vision, and so glaucoma plus central plus periphery means no vision. But if you don't have glaucoma, and you know, you'll lose most of your central vision, but that's the most important part of your vision. It impacts a lot of visual function, and some of the symptoms that you have initially, if you're starting to lose little spots of your vision, especially if you have the dry and there's these corrosive spots, is you're reading something, right? And all of a sudden, there's a missing letter. You go, you know, you move your head, oh, there it is, okay? Then if it gets worse, what happens is that it's a missing word now. You go look at this, and you start. Then eventually, it's a missing sentence. And that's the progression of macular degeneration. Sometimes, if it's just dry, it's a slow progression of that. But if it's wet, then it's all of a sudden, you know, you wake up and you go, wow, that whole sentence is gone. And that's not a good sign. You don't want to ever get to that level before you come to see one of us. Okay? It's very important that you catch it much earlier than that, because that means you've lost considerable amount of vision. And just like the patient I just saw on Tuesday, that's tragic, because I'm not sure we can get his vision back. Now, this is what we want to prevent. And thank God, because of the new treatments that we've developed, late-stage wet AMD has become, I think, a thing of the past. But we're still dealing with it with patients who have had it before the treatments were available, or who didn't respond too well to the treatments. What happens here is that you no longer bleed, you no longer have any activity to it, but it's just a big scar, okay? And just think of the tsunami in Japan again, bringing all this silt and dumping all this sand and silt right on top of the factories. You know, it's very hard to remove. Yeah, I mean, how do you get sand out of buildings, you know, if they haven't been destroyed, right? And that's exactly what happens here, and that's why once you've reached a stage, which is what you need to prevent, there's very little we can do for this, except for some of the hopes that we'll talk about later in the talks here, like things like stem cells, or, well, I don't think we have eye transplants quite ready yet, but stem cells may be a potential here. Now, this is a very important disease, mainly because there's so many people affected. That's why we have a lot of people in this room. And right now, I mean, if you look at the census, these numbers, 13 to 15 million people affected in the US is a very small number, okay? Because it's actually, the problem is that these numbers are past tense. It's like doing the census, you know, you don't know until, these numbers are from like 2005, I think, or 2004, and I think they're wrong. Wet AMD affects 20% of the patients with AMD, causes 80–90% of the vision loss due to AMD, and approximately 200,000 new cases of wet AMD in the US per year. Now, these numbers I quote to you, and I tell you they're going to change. The reason why I think they're going to change is because of this. The main risk for macular degeneration is age. The older you get, the more likely you'll have this, okay? And this graph is percent of people who have macular degeneration, and then the bottom line is the age. So when you're 60 to 64, just ready to retire and enjoy your golden years, you don't have much really time or much risk of having macular degeneration. But let's say you've been in retirement for 15 years. You're around 80 or so. Then look at the incidence. It starts climbing. And that graph, I could extrapolate farther, but I don't have the exact data for it, but we extrapolate that goes up. So by the time you're 85, you have a 1 in 3 chance of having wet macular degeneration. By the time you're 90, you probably have a 50% chance of having wet macular degeneration. See how that works? Now the other problem, of course, is that we are having a wave